So to get us started, I would like to introduce the first moderator, Dr. Phil Brown, who is University Distinguished Professor of Sociology and Health Science at Northeastern University, where he directs the Social Science Environmental Health Research Institute and co-directs its PFAS Project Lab, which has grants from the National Science Foundation to study social policy and activism concerning PFAS, and from the National Institute of Environmental Health Sciences to study children's immune responses to PFAS and community response to contamination, and to develop a nationwide report back and information exchange. He directs an NIEHS T32 training program, transdisciplinary training at the intersection of environmental health and social science. He co-directs the Community Outreach and Translation Core of Northeastern's Children's Environmental Health Center, specifically the Center for Research on Early Childhood Exposure and Development in Puerto Rico, or CREASE, and he's the Research Translation Director and Community Engagement Core co-director of Northeastern's Superfund Research Program, Puerto Rico Test Site to Explore Contamination Threats, or PROTECT. He's a past member of the NIEHS Council. His books include No Safe Place, Toxic Waste, Leukemia and Community Action, Toxic Exposures, Contested Illnesses and the Environmental Health Movement, and Contested Illnesses, Citizens, Science and Health Social Movements. He earned his PhD in sociology from Brandeis University and did his postdoc at Harvard Medical School. I would like to turn this over to Dr. Brown.
Welcome, everybody. I'm very honored to moderate this panel. I've been working with community groups on toxics issues since I started with the childhood leukemia cluster in Woburn in the mid-1980s. And I've seen community residents give so much education, so much knowledge just to themselves, but also to medical professionals, to government, to the media, to scientists. But in all those years, I've never seen a group of community activists as educated and proficient and remarkable as the ones engaged in PFAS activism. So I think that you have so much to learn. Those of you who were here at the first town hall heard it, you'll hear it again. One of the things we did here at the first town hall was strong support on medical monitoring or screening, however we want to call it, as well as educating health professionals. And I do want to say that our PFAS REACH team, which is an NIHS-funded center program to look at the immunotox response that we just talked about in the intro, co-led by myself, Laurel Shader, and Courtney Carrigan. We will be in coordination with Testing for Peas, Community Action Works, and Massachusetts Breast Cancer Coalition, our partners, introducing a series of medical monitoring and screening, as well as health professionals guidance documents in the near future. So we hope you'll visit our website there, pfas-exchange.org, and look at those coming up soon. So we're going to start with Andi Rich. Andi Rich graduated from Lakeland College of Sheboygan with honors and a double major in business administration and marketing. She's an outside adjuster, mainly dealing with catastrophic damages from floods and hurricanes. Andi first became involved as a public health advocate in her hometown of Marinette, Wisconsin, when the community learned that PFAS concentrations greater than 400,000 parts per trillion had been detected in groundwater at the JCI Fire Technology Center. In fact, that facility had been identified as the third largest PFAS contamination site in the nation. Andi has actively advocated for medical monitoring, blood testing in her community, and she knows firsthand that individuals who have been exposed to high amounts of PFAS may want or need to know the amount of PFAS in blood. Andi has actively reached out to legislators, often traveling more than 3 hours one way to Madison to testify before the State Assembly and Senate. She's attended every public PFAS meeting possible, spoke to various committees, testified before the Wisconsin Department of Natural Resources, and actively urged legislators to set health-based limits for PFAS, challenging, often overwhelming pressure from industry to do otherwise. In addition to responding to direct exposures through drinking water, she's been instrumental in raising public awareness of secondary routes of exposure from PFAS-contaminated farm fields, crops, meat, and dairy. Andi has been a dedicated advocate for human health on these issues through public outreach and testimony at local council meetings, Wisconsin DNR meetings, public meetings, and well-researched social media. It's a pleasure to introduce Andi.
Hello. First, I'd like to thank you for the invitation to share my story and your taking the time to listen today. My name is Andi Rich. I am an environmental activist fighting for clean water in my community. I live in Marinette, Wisconsin, which is home to the third largest PFAS contamination site in the nation. Johnson Controls, formerly Tyco, formerly Ansel, made and improperly disposed of AFFF for decades, contaminating the groundwater below their training facility to levels over 400,000 parts per trillion, which has spread for miles in the groundwater plume that is rapidly expanding and has reached levels in the thousands of parts per trillion in private wells just outside city limits. In addition, they improperly disposed of foam from indoor testing down municipal drains. This waste went to our water treatment facility and was dewatered, causing contamination into the Bay of Green Bay and Lake Michigan. In addition, the dewatered biosolids containing PFAS at levels above 220,000 parts per trillion were spread on thousands of acres of farm fields. And I should note that the levels were 220,000 parts per trillion according to one test. Another sample that was tested had levels that were too high to read with the testing equipment, and they opted against diluting and retesting. So the biosolids are yet another of many unknown variables in our local contamination investigation. In addition, the repeated live outdoor fire testing has contributed to unknown levels of air contamination that has spread unknown distances and contaminated residents within an unknown radius, including the students of the local high school, whose property is adjacent to the Fire Technology Center fire training facility. Due to the nature of the contamination and the lack of transparency from the involved companies, local residents now are involved in class action lawsuits against the defendants, who are trying to settle all PFAS liability, exposure damage, and property damages based solely off their well test results from only PFOA and PFOS. As you can tell from the multitude of exposure pathways presented from the contamination in our area, residents are severely lacking the information necessary to make educated decisions regarding their participation in the lawsuits. The level of 2 out of thousands of PFAS variants, in addition to limited consideration to exposure from well water alone, when residents have a multitude of exposure pathways, most of which remain unidentified, is detrimental to the fairness of claim payouts. Participants in the lawsuit, as well as other residents of the area, including myself, have repeatedly requested blood testing and medical monitoring. However, we are being told that blood testing does not equate to illness, that blood testing would not be useful, and that blood testing is not recommended. Clearly, the blood testing would be useful in fairly distributing lawsuit payouts based on exposure, as currently these funds are proposed to be allocated based on arbitrary numbers that do not encompass actual exposure levels of the individuals harmed. As far as blood testing not being useful to personal health care, I disagree with this as well. I went to the gynecologist last August for an annual checkup. While there, the doctor recommended I get a blood test to check my thyroid, not for PFAS, as my thyroid appeared to be enlarged. I live within the city limits. Our municipal water contains 2.7 parts per trillion of PFAS, and I attended the local high school for all 4 years. I also attended the local middle school for 3 years prior to that, which is located adjacent to a second Johnson Controls manufacturing facility, as well as Chem Design, who distributes PFAS to Johnson Controls, and all of their smokestacks are constantly pumping out unknown levels of unknown contaminants, which may very well include PFAS. At the time of my doctor visit, I was already stressed out, preparing to leave for a work deployment, and all too aware from my activism that thyroid issues are a common side effect of PFAS exposure. And this news from the doctor caused me to break down into tears. As the doctor attempted to comfort me by stating she wasn't a thyroid expert and she wasn't condemning me to a negative diagnosis, I responded that it wasn't her or anything that she said. It was just overwhelming, as I have been active in raising awareness about PFAS, and this was just the breaking point for me. She gave me a blank look as I told her this, and I explained further that I was talking about the PFAS contamination from Johnson Controls. The blank look didn't change, so I asked her where she was from. She replied that she was here from Nashville, and Bellin Health, our local hospital, brought her here as part of a traveling program where she would be here for 6 months before moving to a new location. This concept of traveling practitioners makes blood testing, medical monitoring studies, and the results-based guidelines even more crucial to comprehensive patient care. How can above average incidence of PFAS-related illness be identified in a community where the doctors aren't in town long enough to identify the trend? Going back to the DHS responses to our requests for blood testing and medical monitoring, where they claim the blood tests are not useful, I would like to point out that I still haven't gotten my thyroid blood test. My healthcare coverage is expensive and it doesn't cover much, so I have put off this test due to time constraints, COVID-19, and my personal finances. That said, I also realize that catching almost any ailment early is far more beneficial to waiting for it to progress, but life does happen. If I, for example, knew for sure I had elevated levels of PFAS in my blood, I would be far more likely to prioritize further investigation. But right now, I am deployed to Alabama from work, and I will have to wait until I return to Wisconsin to follow up and seek either a diagnosis or a clean bill of health. The closest comparison I can come up with to explain the usefulness of blood testing for people like myself is the BRCA test for the gene that increases your likelihood of developing breast cancer. It is not a direct correlation, and it does not guarantee that you will get breast cancer, but it is an indicator of increased potential for the illness and gives women the knowledge that self-breast exams are extra important and that they should be diligent with their personal health, just as elevated levels of PFAS could be utilized by doctors as an indicator for increased potential for thyroid disease, thyroid cancer, kidney cancer, osteocolitis, pregnancy-induced hypertension, as well as others. As we all know, that catching any ailment in its early stages increases your likelihood of successful treatment, I am astounded by DHS's insistence that these blood results are not useful. ATSDR is already funding 6 studies on PFAS health effects, indicating the government is interested in this information. If the third largest PFAS contamination site in the nation, with a multitude of unique exposure pathways, many of which are still unidentified, doesn't qualify for blood testing and medical monitoring, who does? Marinette is an impoverished community. Most residents cannot afford the $600 it costs for the blood test without some sort of assistance. And all but one person whom I've spoken with regarding this was denied coverage for the test by their health insurance. Your recommendations that will stem from these presentations are crucial to our care and survival. Access to blood testing and medical monitoring has the propensity to identify additional exposure pathways as well. Currently, the focus is on individuals with contaminated wells, but medical monitoring and blood studies may show increased levels in current and/or former employees of Johnson Controls facilities. It may show increased levels in our high school students, which could indicate that air exposure pathways are serious and need to be addressed. Almost unbelievably, Johnson Controls continues to perform live fire testing indoors. They will not disclose which foams they continue to use on these fires, but they have acknowledged that the foams being tested contain PFAS. And we do know that they still have an unexpired contract with the military, which includes foams with the 8-chain PFOA and PFOS chemicals. This is of great concern to us, as we know that PFAS gets into the air from AFFF use on live fires, and the air filtration technology to remove PFAS from the air prior to environmental release simply doesn't exist. And please don't forget, the training facility is located within city limits, right next to our high school and our shopping mall. As you can see, it is critical that we do everything we can to gather as much medical data as possible regarding the effects of PFAS, as the contamination is still ongoing for us here in my community. We need help putting a stop to this, as the corporate polluters are far more powerful than our voices, and we need to stop the cycle of not doing anything because of lack of data and not collecting data because of lack of evidence of harm. Thank you again for your participation in these events. I hope you take these testimonies and help people like me and communities like mine. We desperately need it. and I'd be happy to answer any questions.
Thank you, Andy, for that very complete and important testimony.